Well, good morning, everyone, and welcome again to another live this morning. Hope you're doing well. Hope you're having a great start to your day. Hope you've had your vitamin C, coffee. Annette, your first one up. Mike from Norland, good morning. Elaine, how are you? Judy, good morning. And Charles. And Rosalinda. And Brahim, good morning. Deborah. Lori. And Mary Jane from Connecticut. Sherry, good morning to you. And Nellie, good morning, Nellie. Micheline, bonjour. And Linda. And Nick from our staff. Jerry. Our Habs, Jerry, our Habs. Nick. Another Nick, but Nicole, Claire, Carol, New Brunswick, Moncton. Helen, good morning, bonjour. Maria. Shireen. Jean. Jane. Couple more. Joanne, good morning to you. Wendy, good morning, Wendy. How are you? Jocelyn, Sturgeon Falls. Debbie, how are you, Deb? You miss me? Mila, Rita, Dwayne. Good morning, Dwayne. Francis Marie, how are you? Jackie, how are you? Cami, I like that. Cami. Josephine, good morning to you. And Yolande. I was waiting for you, Yolande. Judy. And how are you? Diane, Lorraine. Okay, we're going to get going here. Another Maria. And Dale. Nancy. Zian. And Jean. And Deb. Good morning, Dorothy. Okay, here we go. Questions. First question up here is from Milika asking about the gut and preventing a blockage. Preventing a blockage in the gut. That can be very serious, by the way. It can lead to sepsis. Gut gets blocked, or the bowel gets twisted. You can poison your blood from all the garbage going into your blood and giving you sepsis. So, but let me speak in generalities here, just about the gut. And Tony Jr. and I talk about this all the time. If you got an angry gut, bloating, discomfort, pain, gas, diarrhea, chronic constipation, you got trouble with the plumbing. So anybody that has any kind of digestive issue knows exactly what I'm talking about. The bowel gets inflamed. We wrote an email about that yesterday, where it's like getting a sunburn. And doesn't matter. So let me just give you some overall principles on keeping your gut, like getting your gut into good shape, and then preventing your gut from going into, a bad state again. Okay, so let me just talk about that because it's a great question, Milika. Okay? Find out what foods bother you. I tell people, find out, be your doctor. You don't need to spend, I used to work with a lab. And they would, if you sent them $600 to do all the sensitivity and allergy tests for the gut, they'd send me a check back for $200. okay, because I was a referring physician to the lab. And they were good. I mean, they were a good lab, give you an extensive report. But you know what I used to tell my folks? Be your own doctor. Figure yourself out. Listen, Linda. Listen. Your gut will talk to you. You eat certain foods. Ooh, that bothers me. Do a checklist. I always told mothers, be Dr. Mom for your kid. Find out if they have an allergy. They might have an allergy to sensitivity. It may not be a true allergy. It might be a sensitivity. You give them dairy, especially milk and that, and it bothers them. You got to figure that out. So number one, Milika, I would say, number one, find out what foods you do well with and stick to the plan. You don't do well with pizza or whatever. Well, you know what? Stop eating it. Secondly, fiber is overrated. Don't use too much fiber. I always emphasize this. You're not a rabbit. You're not a cow. They're meant to eat grass and salad and a lot of oxalates, a lot of lectins in vegetables can bother your gut. Extra fiber can bother your gut. So I'm not saying never have fiber. I'm not saying that. All I'm saying is don't overdo it. You have no idea how many people I have taken off of fibers. You know, it's like you have an open wound and you're rubbing it. It hurts. And fiber, I know it's meant to scrub your bowel, but you don't want to use don't use a steel brush to scrub your bowel. Water is the best scrubber of your bowel, not fiber. And like I said, I know everybody got to get fiber. But, okay. Now, the other one, of course, and this is for whether you have a gut problem or not. You know how big I am on probiotics. But broad spectrum probiotics do different things. There are different ones that cool down inflammation, like rhamnosus. It's an anti-inflammatory specific strain of bacteria. That's why we put it in our IBS formula. Someone was asking this morning about apple pectin. Well, yeah, what do I think of it? Well, I like it. If I didn't like it, it wouldn't be in our IBS formula. The other thing is, in the IBS formula, we put a lot of what they call mucilages. Think of just recoding the Teflon. Making your gut not near as sticky. And like slippery elm and marshmallow root. Those are things that I've liked over the years. And of course, L-glutamine, which helps to regenerate the gut. So we have that in the IBS formula. I love bone broth. So if you've had a bad gut, and that happens to be your weakness, probably about half the population have digestive issues of some kind, then you really got to take extra care of it. So find out what you don't digest. Everybody's different, but a lot of people, like me, I got to be careful with broccoli. It irritates my gut. I like it. I like broccoli. I got a grandson named Brock, and I call him Broccoli. I love broccoli. But all I'm saying is, be a doctor on your own. Figure yourself out, And whatever irritates you, don't be deceived. The worst deception is self-deception. Don't deceive yourself. And you know what? Sensitivities can come overnight too. Like, stuff that never used to bother you bothers you now. So I'm big on that. And number 2, regenerate the gut. The gut will regenerate. One of the ways it regenerates is through probiotic. And again, digestive enzymes, because as the food goes down into the gut, before it gets there, you want it to be micro-sized. What a lot of people have trouble with is acidity in their stomach. Oh, doc, I got too much acid. Yeah, it's because you don't have enough. What? Well, when you don't have enough acid in your stomach, your proton pumps in your stomach will make more. And that's when you get acid reflux. But a lot of people, especially as you get older, you're not making as much acidity in the stomach. You need that acidity to mulch your food down so it's micro-sized by the time it gets into the small intestine, where the absorption of your nutrients are going to take place. But a lot of times where people get autoimmune and things like that, it actually starts in the stomach. And as that food goes through the stomach, it's not broken down enough. And then you're not absorbing B12. I mean, B12 is a finicky vitamin at the best of times. So there's a lot that goes into digestion. The stomach, enzymes. I'm big on digestive enzymes. But again, I'm telling people this is prevention, but it also is for the folks that are listening to me right now. And I know a lot of you. You got a bad gut. And then you add stress. Stress is this. Ooh. Okay? That's what cortisol does. Over a period of time, it'll mess up your gut too, because it creates a diversion. Think about it. A lot of people got digestive issues because they're stressed. The butterflies, I got a big test today. I got butterflies. Well, that's cortisol, and that's all right, as long as it doesn't last. But if it lasts, cortisol will disrupt the gut because it diverts your digestion. It's the fight or flight. If someone is chasing you, the last thing you're thinking about is digesting food. Who cares? It's the fight or flight. Problem is, if it lasts a long time, it can affect your digestion and your absorption of nutrients. A lot of people, you add stress, and that is the perfect storm for the gut. So get your stress levels down, because that can irritate your gut like nobody's business. And doctors, they never even think about that. Yeah, you know what I mean? Like IBS, you got IBS. Well, gee, you didn't have to go to medical school to give me that diagnosis. My bowel, IBS, my bowel is irritated. Okay. Doc, why? So that's a good question, Milika, to start the question and answer this morning, okay? Because a lot of people, like I said, more than a majority of people have some kind of issue in digestion. And when the plumbing ain't working, it ain't no fun. It really takes away from your quality of life. And I'm very sympathetic to that. Okay. Good question, Milika. Okay, I hope I answered it. Amal, can you talk about osteoarthritis? Well, there's several types, Amal. You can have osteoarthritis because you have degeneration in the joint due to wear and tear. Wear and tear. Old injuries. Old football injuries, or old, you had an old injury and it healed up, but it healed up with some degeneration. And your body is smart, you see. What it does is osteoarthritis a lot of times is just your body giving you what they call osteophytes. And it's just like sort of their anchors so that you won't move as much and it won't hurt as much. The only problem is, you get bone on bone. You know what the big thing is today? Like, again, if I'd have had a way to look into the future, oftentimes, like when you think of, because people are bigger today, okay? That puts a lot of pressure. I tell people that really, they're overweight. I said, well, it's only a matter of time till your joints wear out, especially your hips and your knees. Now, that can happen from injuries. It can happen even when you're skinny. But a lot of that, like you look at orthopedic surgeons today, I mean, in Canada here, you'll wait a year, 2 years to get a knee replacement or hip replacements, or it's unbelievable, but the amount. So osteoarthritis can be wear and tear, gets bone on bone, not as much mobility. It can come too from, there's a way that your joints start to wear down. I talk about that oxidative damage. One of the ways your body ages in the joint is what we call end products like caramelization, AGE. It's glycation. And that can, you know what kills your joints and can cause osteoarthritis over the years? Sugar. Because it causes glycation. Glycation just takes away the lubrication in your joints and your muscles. This is one of the reasons that we love the reset, because that really helps to lower your glycation. And then you can get rheumatoid arthritis. You can get gouty arthritis from uric acid crystals. And like I say, it's part of aging to some extent. I'm always big on move, and get strong. One of the things that'll take away pressure from your joints, guys, is when you have strong muscles. Strong muscles. It's important to be strong. Strong. Muscles will help to anchor your joints. So, good question. And of course, too, the other thing, Amal, is that we love our inflammation formula. 8 natural anti-inflammatories and bone builders. I really like that formulation. Okay. Rakaya. I hope I said that right. When D3 intake is coming directly from the sun, does one still need vitamin K2? Well, I love the way you're thinking, right? Rakaya, you're thinking, I want that. Well, look, you know me in vitamin K2. I love vitamin K2, okay? And I want you to eat it. Look, we put it in our vitamin D. But when you get in the sun, you don't have to worry. You see, one thing about the sun is you top up on your vitamin D. Isn't it funny, though? 20 minutes, you get 10,000 international units. If your body makes 10,000 international units, think about this for a minute. If your body makes, by getting in the sun, in 20 minutes, no sunscreen, comes mainly through your arms and legs, okay? So you got to have a t-shirt on and shorts or a bathing suit. In 20 minutes, you get 10,000 IUs. So let me just ask a question, okay? Think along with me. How can that be bad for you? If in 20 minutes, you get 10,000 international units measured, How can that be bad for you? Okay? Now, vitamin K2 is an essential vitamin. But you don't have to take K2 as a supplement. I mean, we put it in our vitamin D when you're supplementing. But when you get it from the sun, God wants you to eat your vitamin K2. Where do you get that from? Where do you get vitamin K2 from? The animal kingdom. Cheese and butter are your highest sources. Eggs, meat, and cheese. Isn't it funny? They had them on the bottom of the list of that Tufts University. You get 100 points for the best foods, and they had all the cereals on top. Oh my, I still get a headache when I think about it. But guys, you're supposed to eat your vitamin K2. Eat it. Okay? So you don't have to worry about getting 10,000 international. And by the way, you top up. You're not going to get 100,000 in a day IUs. Like if you stay in the sun past, isn't it amazing how your body knows? Your body won't go past that. Oh, I stayed in the sun 2 hours. Did I get 200,000 international units of vitamin D? No. Your body tops up on a day. Because you know what it wants you to do? Go get it again tomorrow if you can. Of course, you live in Northern Ontario. What did I tell you? Okay, because last week, I think one of the days this week, it was 22 or 3 degrees Celsius in Sudbury in October. But I said, coming to a theater near you, I don't know if you want to call it climate change, but the climate changed. It's freezing. We had frost this morning. I'm not a prophet nor the son of one, but I could have told you that in Northern Ontario, we're going to get winter. It's not going to bypass us this year. Okay? So now's the time to supplement with your vitamin D. Now's the time to supplement. And when you supplement with vitamin D, K2 is important. When you supplement, not in the sun. Your body, it's amazing how smart your body is. It tops up. Because people ask me, I think I might even got asked here this morning. Let me just check my questions. I thought I saw another question on vitamin D. Okay. Giordano, what's the difference between MK7 and MK4 for vitamin D3? Well, they're both made from natto, okay? And they have, it's a K2. You read different strokes for different folks. You get on there, what's better, MK7? I find that the best. That's the one we put in our formula. But I like MK4 too. I got no problem with that. But eat it. I want you to eat your butter. Cook your steak in butter. And then put butter on top. You're getting vitamin K2. Eat your cheese. Cheese curds have the highest source of vitamin K2. Okay, very, very, very good question. Okay, Pina, can I use Epsom salts on my granddaughter's bath? She's 4 months old. Well, just a little bit. Put a teaspoon in there. You're not going to overdose on Epsom salts. they're okay. I love Epsom salts. They're good for you. That's magnesium. It's magnesium. It's a tremendous way to get magnesium into your body in a nice warm bath. Good for you. Okay. Now you're not going to put a little bit of Epsom salts in a 4-year-old. Not going to hurt the baby. Nicole, what supplements would you recommend for loss of balance after losing hearing? Well, you usually get either a tinnitus The middle ear, I love a Navitol. I always tell people, look, if you got trouble in the middle ear, you want something that elevates your levels of nitric oxide. Remember what I said? Nitric oxide opens, relaxes your blood vessels and those little wee capillaries in the eyes, in the middle ear, the little wee blood supply, the little capillaries. I love the nitric oxide. What elevates nitric oxide? Pine bark, Navitol. B12. B12 is important. Balance issues, B12. A lot of people, oh, doc, my B12 is normal, according to doctors. That test is 100 years old, and you need to optimize your B12. So those are things that I watch for. Nick, thank you. I answered your question, Edith, about apple pectin. Okay, we use it in our IBS formula. She said, I read that they used it in Chernobyl to get rid of toxins. Yeah, it does detoxify. I like apple pectin. Okay, an apple a day keeps the doctor away. Not anymore. When I was a kid, an apple a day kept the doctor away. Okay, then it went from an aspirin a day keeps the doctor away. The pharmaceutical company Bayer took over. Now they don't want you to take aspirin every day. And I'm not big on eating too much fruit, especially in this day and age of fructose and the liver. So, now they're God's candies. Be careful. Don't live on fruit, okay? But apple pectin, the actual extract, is very good. Carol, if you have kidney problems there's another one on vitamin D. I knew it. If you have kidney problems in the past, can taking too much vitamin D damage the kidneys? Yes and no. Okay, Carol, yes and no. It's always a possibility. But I just want to tell people, okay? I want to tell people. Toxicity from vitamin D is like unbelievably rare. Okay? And I know it's a fat soluble vitamin, but remember, it's not just a vitamin. Vitamin D is a hormone. Your body needs it. Your body's not going to operate without it. If you're scared of your kidneys, well, then don't overdo it. That's one of the reasons that MK7 is put, like vitamin K2, is put in our vitamin D. For people especially that are taking, because what happens to the kidneys? Well, you could calcify. You could get kidney stones. You know how many people get kidney stones from taking too much vitamin D? It's so rare, it's hardly even worth talking about it. The biggest thing, okay, the biggest thing that you have to worry about in your kidneys is, Carol, is sugar, okay? Because sugar, what it does, sugar is so destructive to the kidneys. So if you've had kidney damage, worry more about sugar than vitamin D, okay? Look, you don't have to, but here's some studies that were done by the Vitamin D Council. In order to become toxic to your kidneys, you know what they're saying? This is what they said, not what I'm saying. They said you would have to take 50,000 international units a day for 6 months every day before vitamin D becomes toxic. I'm not telling you to do that. I'm telling you that the safety of vitamin D is incredible. But remember, you have to go behind the news of the news. They vilify vitamin D. Why do they vilify vitamin D? Because nobody's making any money on vitamin D. And, I hate to be negative, and I don't want to just always, pile on to the pharmaceutical companies. Oh, they're making, what is it, 19 billion a day? Ooh, and anything that gets in their way, they're going to vilify it. A study came out, I think it was 2 weeks ago, that said, well, aspirin is could be helpful for COVID. And boy, did aspirin ever get it the next day. You're not supposed to take aspirin every day. And of course, I've been saying that for a lot of years, right? I did a thing on aspirin. I wonder if I could find it and actually put it up on our private Facebook group. Maybe I can find it. I did a video on aspirin, and we had over 1 million hits on it. And this was 4 or 5 years ago, and I said, you know what? Because the FDA came out back then and said, you know what, you shouldn't be taking aspirin every day. Yeah, I said that a long time ago. People, you should have seen some of the comments. Well, and they were mad at me. I said, what are you getting mad at me for? It was the FDA that said that, not me. Well, I said it too. I'm not saying aspirin's no good. The FDA said just don't take it every day. Take it if you're having a heart attack, and even then. Okay? I'm only telling you what they said. Don't shoot the messenger. Okay, good questions. Oh, Meta. My doctor told me I have severe scarring on the liver. Can it regenerate? Yep. It's amazing. Your liver, you see, you can't live without your liver. You can't. You can take your spleen out and you can live. You'll get plan B to make your red blood cells, okay? You can live with one kidney, okay? There's a lot of things, you can't live without your liver because it does over 600 things. And we're going to show a study next week on fatty liver. Again, another one. Interesting, this one. Very interesting. But can it regenerate? Yes, it can regenerate. Do the reset. Get the fat out of it. Get the scarring out of it. Now, you might always have a weakness, but it can regenerate. Now, if you have cancer of the liver, and it can't, by the time they find cancer of the liver, usually, it's way too late. There's very few people that survive liver cancer. Okay? Now it's usually, like I said, it's not easy to detect. It's always, when they find it in the liver, usually late stage cancer. Been there for a lot of years. So clean your liver out. One way to clean it out is do the reset. The other way is to drink a lot of water. Drink 2 liters of water. Water cleans. Water cleans your gut. Water cleans your blood. Water cleans your liver. You don't have to spend a lot of money to clean your liver, And quit eating carbs, because they get stuffed up in your liver. Crappy carbs and that high fructose corn syrup. There's nothing that will scar your tissue, your liver, like that. Now, you can get hepatitis, I understand that. And you can get cirrhosis of the liver, from alcohol and whatever. Good questions, okay? That was Meta. Lynn, what's my opinion on moringa leaves? Well, look, there was a whole thing, 10 years, maybe 15. Moringa. I heard it all over the place. There was all these multi-level companies coming out with this was the best thing since sliced bread. It cured everything from pimples on your nose to whatever. It fixed everything. And I'm skeptical, I don't dismiss things, but I'm skeptical. Like, show me. And when I hear it's the greatest thing since sliced bread, remember, we've been around a long time, okay? My grandfather, I mean, they made up, if I had told you some of the potions my grandfather made from every herb. He used pine bark before I did and made up these teas and ointments and, but in none of his annals that I've ever seen or my father passed down to me were moringa leaves. Do I say they're no good? I'm not saying that. I just, like me, sometimes there's a lot of fluff and not necessarily science, but I'm not against them, okay? You show me proof and I'll read it. Joy. Oh, on vitamin D again. Joy says, when I take vitamin D from the dropper, okay, you must be talking about ours, I cough like crazy. Well, okay, I can't use, Joy, the word weird. Joy, you're unique. Okay, you're unique. People told me, okay, you can't use that word anymore, Dr. Martin, because I used to use it in the office every day. You know what? You're weird. And I didn't mean it because I didn't love you. I just want to tell you, when 99.9% of the people don't get what you got, that makes you unique. And some people say weird, okay? I know people that can't drink water. I actually met a person that they're allergic to water. Okay. We're not going to write up a medical book about it because you happen to be allergic to water. Nobody else is. You can't live without water except you. I don't know how, but we all got our different fingerprints. There's over 7.5 billion people on the planet, and nobody has a fingerprint like you. You're fearfully and wonderfully made. And Joy, even you. Okay? I'm just teasing, Joy, please. Okay? I'm having fun this morning. I don't mean to pick on you, okay? So, yeah, there's other ways of delivering it. Okay? You can actually pick up some capsules if you want and put that oil right in a capsule. Or, one way of delivering vitamin D to, in our dropper is, take it and just put it on your gums. Put 1 or 2, whatever the amount of drops you're using, and just put it right on your gums. You don't even have to swallow it. Just rub it in. Could you rub it in on your skin? Yep. It will, you might not be getting the amount that you want. Skin is a wonderful way, but I would say rub it, Joy, in your gums. And if you start coughing from that, I can't help you. No. I'm a big tease, eh? Sorry, Joy. Okay? And I mean it, Joy. I'm just teasing. Chastity. Does eating eggs and cheese raise estrogen? No. Okay, she's asking about estrogen receptive breast cancer. Just the opposite, Chastity. Just the opposite. What will raise your estrogen is all those chemicals out there. Anything that you can't pronounce, that's in food, that's in preservatives, that's in the soil, it's everywhere. Worry about that. But cheese is good for you. Cheese has vitamin K too. Cheese has, you name it, the best source of protein and healthy fat. It's a cancer fighter. And so is eggs. Like a perfect food with no carbs. When you got breast tissue, what did I tell you? estrogen, and you're right, look for it. And make sure, Chastity, this is why I love dim out that estrogen and lower your insulin. So don't eat crappy carbs. Okay, Marilyn, stenosis of the spine. That's really when you're narrowing of your canal, where your spinal cord goes down, and again, can bring it back a little bit to Marilyn, to what I talked about in osteoarthritis, even though it's not osteoarthritis, but it is a degeneration. And you know what I would say to you, Marilyn, more than anything else with stenosis, what I tell people? Get strong, man. Get strong. You've got a weakness now. You got stenosis. Get strong. Let those muscles take away that pressure from your spine. The muscles. Get strong. Get your back strong. Get your legs strong. It really does help. Okay? Michelle, can you explain the reason behind hypoglycemia not related to diabetes? Well, look, some people have trouble with hypoglycemia, low blood sugar. It can be the adrenals. Stress can do that over a long period of time. I wrote about it in books on chronic fatigue syndrome. Oftentimes they would go into hypoglycemia. Their blood sugars would fluctuate up and down and up and down. In type 1 diabetes, of course, and you say, well, without diabetes, but usually stress. It's usually a sign. It's usually a sign that, Michelle, that you got adrenal stress. That's where I saw hypoglycemia the most. And hypoglycemia can be in kids when their blood sugars get low. That can be a sign that they're developing insulin resistance. Okay, good questions. And Mary, I'm taking Vasipa. Vasipa is a pharmaceutical grade omega-3, okay? It's expensive as all get out if you don't have a drug plan. But I like it. I had no problem with it. What I benefit from taking DHA also. Yeah, because Mary, I would tell you yes, because Vasipa takes all the DHA out of it and uses strictly EPA. Okay? And they talk about lowering triglycerides with that. Okay? It's actually a med. It's a high grade, pharmaceutical grade, natural product. Okay? And they just got a patent on it because they were able to just keep the EPA. So in that healthy fat, you have EPA. I like EPA. Guess what I like better than EPA? DHA. Because your brain's made up of DHA. And you know me and DHA, and they talk, like I think I've talked to you about this even recently again, is tumors don't like DHA. They hate DHA. It makes them explode and burst and get rid of them. I love DHA for the heart, for the brain, for cancer, for joints. I'm a big guy on DHA. So I would add it, Mary, if you're using Vasipa, because you're not getting any DHA in Vasipa, okay? How much protein would, Stephanie, how much protein to maintain muscle mass? Well, look, you're not going to get a number from me. I don't do that, okay? But if you eat the right things, you need protein to make muscle. It's as simple as that. You need protein to make muscle. And the amount, well, if you're wasting, you're not eating enough. Now, there could be other issues. There could be digestive issues. There could be hormonal issues. There's a lot of things that go on to, for muscle. Because I saw a lot of women that started their menopausal years and go into sarcopenia, or muscle wasting, and it was hormonal. So you got to balance all that. But look, you're never going to overdo eggs, meat, and cheese. Okay? You're not. That's why I don't give you a number. But usually when you're eating the right foods, the right fuel, you don't need as much. When you have, protein is king. So if you're eating enough, your muscles will be maintained. If you start seeing, you know what, I'm not getting your butt up. And women, ladies, I speak specifically to you mostly. Women are notorious for not eating enough protein. They're notorious because they bought the lie that salad is good for you. And they think that's good. There's no protein there. That's for mice. Okay? You know my statement. Popeye didn't get strong from eating spinach. He lied. Okay. Put up with my nonsense a little bit. Medipod. What can you put in your ear for pain? Well, you be very careful what goes in that ear canal. Okay? Be very careful. Look, it depends what's in there. Like if there's a low-grade infection in there, you might put a little bit of a probiotic powder, with a little bit of coconut oil or whatever, just to allow it to enter. And you can put that in the ear canal. Like I'm very careful, even with oil of oregano, it's very strong. You better dilute it. Be careful what goes in that ear, Medipod. Well, Nicole is asking, what can I do to get in my winter months to get 20 minutes of sun? Well, good luck. Do you live in Florida? No. Well, you're not going to get your vitamin D from the sun. Now, the sun is still good for you. Okay? I just want to remind you, Nicole, that the sun is still good for you in the winter. It's 40 below and it's sunny. It's still good for you. You know why? Because as long as your eyeballs are open, you're going to get melatonin from the sun. You're actually bringing in a hormone, melatonin. Your body makes melatonin, but it needs the sun to make the right amount, and then pitch black at night. Okay? But you're not going to get your vitamin D in the wintertime unless you live in Florida. Okay. Who's asking this question here? Let me just see. Somebody's asking about, it's sort of cut off. I can't tell. Did I do that, or who knows with me? Let me see if I can get a little bit bigger here. No, I can't. Anyway, someone's asking, why doesn't carbonated water work the same to hydrate as ordinary water? Good question. I'm glad you're thinking. Carbonated water, I call like Perrier or whatever. There's nothing wrong with them. I mean, you know what? You know what I mean? I like it. I like the taste of it. I do. Okay? And it's not like it's bad for you, but it ain't water. When they put the CO2 in it, carbonated, now your body has to take that in a different route. Your water that you drink, if you're in a desert and you hadn't had water for 24 hours, you're not going to hydrate with carbonated water. Not that it's not harmful. It isn't. But your body knows water, and only water is water. You carbonate it, your body, it doesn't mean, like I said, I'm not saying it's harmful. All I'm saying is it will not hydrate. It will not hydrate. There's no calories, for people that, doc, I don't want to have any juice or whatever. I mean, sugars. And yeah, there's no sugars, but it's not water. Only water is water. And the best water is mineral water because it's got natural salts in it. Okay? So, good question. Somebody's asking with, it could be Kathy or whatever, is the truth that berberine is an alternative to metformin and claims it lowers LDL? Well, who cares if it lowers LDL? And 3 fat balls triglycerides and raises. Look, berberine, you know what? I'm not saying I don't like it. Again, when on its own, like if you look at our insulin formula, okay, look at our insulin formula. I got, what, 6 different supplements in there. 6 different ones. I like combinations. Berberine, yeah, I got no issue with it, but I wouldn't do it on its own. I don't find it that effective on its own. I like combinations. And one more. Glenna, what effect does nutritional yeast have on fungus or candida? Well, I'm not too worried about nutritional yeast. Some people take it as a supplement, right? Like a brewer's yeast or whatever. And but yeast in bread, it's not that the yeast, it's the carbs that feed the candida. Okay? It's the carbs that feed the candida. So, I'm not too worried about yeast. Yeast outside of your body, you make bread or whatever. Inside your body, it makes things grow, and you don't want to feed it. And what feeds it more than anything else is sugar. Don't feed the bears, Glenna. Okay? Okay, guys. I think I got to pretty well every question there. Might have missed it 1 or 2. We appreciate all those questions. Okay, so the Martin Clinic Facebook group. If you're not a member, your friends are not members. If your family's not members, you can make them members. Okay, invite them to join that wonderful group. Okay, and question and answers. Send in your questions. I'll try and answer all of them. Okay, on Question and Answer Friday. Love you guys. Talk to you soon.